Welcome back again to the Silent Struggles channel, a platform where we create awareness, empower one another, and inspire each other on matters concerning mental health. So today, we are privileged to have a guest who happens to be a palliative nurse. And if you can remember, guys, on our previous episodes, we were discussing on some of the causes of mental illnesses, and chronic illnesses were among the causes. So today, we have a guest who is going to expound more on that, and I believe that she's going to shed more light on the same. Okay, so allow me to take this golden opportunity to introduce our guests.
Thank you, Jen. I'm very happy to be the guest in your platform, and I usually admire you, the work that you usually do. For my viewers, my name is Emily Oduor. I'm a palliative care nurse. I've been in the service for a while now, and what I can say about palliative care, I'm happy and I'm satisfied with whatever I'm doing. Thank you.
Welcome so much, Emily,
Thank
to
you.
this channel, and feel at home.
Thank you.
Yeah, so on our today's episode, I want you to shed more light on matters concerning palliative and chronic illnesses. So probably to start us with, help us understand what is the relationship between chronic illnesses and palliative.
Okay. Thank you, Jen. And for us to understand the palliative and about palliative care and chronic illness, we'll get it from the definition and the examples of the chronic illness as the term Jen has used. But now in my definition, palliative care is a care like any other care, but it's a care that is given to patients and their families who are facing problems associated with lifelong illness. I like to use the word lifelong illness compared to chronic illness. Yeah. And now when you're talking about palliative care, when does it start? The question that comes, when does it start? It usually starts when the patient has been diagnosed. It does not start when the patient is dying. Yeah. So when you're talking about palliative care, I've said it's about the care given to the patient and the family who are being faced with problems associated with lifelong illness. And now when I'm talking about these problems, maybe someone may ask, what are these problems? Many a times when the patient comes to the facility, we usually think it's about physical. Yeah? But the problems that I'm talking about, I can sum it in 4 words, or I can talk about total concept of pain. And these problems, it's about social, it's about physical, psychological, and spiritual. Yeah. And now when also one thing also to note is that when you're talking about palliative care, we are talking about early diagnosis, we are talking about proper assessment, and also we are talking about treatment. Yes, thank you.
Okay, thank you so much, Emily, to that fire. And probably we will wish to understand what are some of the examples of these lifelong illnesses.
Thank you. For my viewers, maybe one day you have heard about palliative care, but many people that have come across, even in the hospitals, many still they don't know what is palliative care. Still, the people who work in the facility, Jen, they don't know what is palliative care, or even if they know, they think palliative care is dying. Yeah, and that's the reason why many a times you will be called when the patient is in a critical condition. Yes. So remember, palliative care, there are many conditions. Just to name a few, we have HIV/AIDS, and now when I'm mentioning these conditions, now let us just talk about the treatment. The treatment or management of HIV/AIDS is long-term, yeah, because these patients, they take the drugs their entire life. So when you're talking about lifelong illness and also long treatment management, I think now we can be able to relate about palliative care. We have diabetes, we have high blood pressure. Many a times you come across a patient who was diagnosed with high blood pressure, put on medication, and then they'll tell you they stopped taking the medication. When you ask why, they'll tell you that I felt better. But what I usually tell this patient, go back to the doctor, just follow up your clinic so that the doctor will be able to assess you, yeah? Because many a times they'll default treatment, they'll default clinic, and now what happens? Complications of high blood pressure. And we see many patients, they end up being done dialysis, yeah? So we have high blood pressure, we have renal issues, we have cardiac issues, we have seen children who have cerebral palsy, we have seen patients having cancers, we have seen patients having Parkinsonism. So there are many conditions. We have patients with schizophrenia. Also, those are palliative care. We have elderly. They are palliative patients. Remember, we had COVID in our country. During that time, also COVID was termed as palliative condition. Because remember, in COVID, still there are patients up to now. They have issues with their lungs. They have fibrosis. Now that was as a result of COVID. So there are many conditions under palliative care. Yes.
All right. Thank you so much, Emily, for shedding more light on the same.
Yeah.
And I understand that sometimes these chronic illnesses or lifelong illnesses, as you have told us, usually they have a psychological impact on an individual. What do you think about that?
Yeah.
What is the relationship between chronic illnesses and the mental wellness of a person?
Okay. Thank you, Jen. And also for my viewers, many a times when we think about palliative care, what comes in my mind, maybe I may think it's pain. I may think maybe the patient has wasted. I may think maybe the patient can't feed. But now it's more to that. Psychologically, even you as an individual, you are there, you are sick. Now you are just suspicious, maybe it can be this, it can be this. Many a times we have patients, even biopsy has been done, the waiting period, 2 weeks waiting period, 3 weeks waiting period, even for a month. These patients, they go through a lot. Yeah, they are very anxious because you don't know what the outcome of the results. Many a times also, after the diagnosis, maybe in the family still there's a person who was diagnosed in the same, there's a loss in the family, so there is fear. What about me? Yeah. Also there is depression, and that's the reason why I usually say that if I meet a patient today and then I tell you about the diagnosis and you deny the results, for me it's okay. I don't expect the patient to tell me that I'm okay, because sometimes the facial expression that the patient I'll see from the patient is different with whatever is going in, yeah, through her mind or his mind. So there is depression, there is anxiety, and if we don't bring up the team that will talk to these patients, many times these patients, they end up in depression. And many times when also we talk about a disease and people talk about death, we think that a person will only die because of the disease. But we forget that depression also can lead to death. Yeah. So when you're talking about palliative care and mental health, and also Jen, I think also I'll just talk a bit about, remember from my definition, I say that I'm going to use 4 words. And it's good that you have brought up the issue of psychological issue. Yeah. But in palliative care, when you're talking about like total, the domains of palliative care is 4. Apart from the psychological part of it, we have the social issue, physical, and you have the spiritual. Many times when we have a patient in the facility that I've met, what brings them to the facility is pain. Jen, if I don't have pain, I not come to the doctor. Even if a patient has a lump, you'll find that when you're taking history, the lump maybe has been there for 2 years, for some months. But since there was no pain, this patient, they never saw the importance of going to a facility. So when you're talking about palliative, when you're talking about social, because let me just put psychosocial, yeah, psychological and social pain. So when you're talking about psychosocial, these are two things. Huh? So if today a patient has been diagnosed with a lifelong illness, let me say he is a breadwinner in the family, we'll find that there is a reverse of role. He used to provide for the family. Today he's sick. He'll not be able to go to work. Now, who is going to do that work? The responsibility, maybe if the mother is there, it will fall on the mother. Or if the mother is sick, the responsibility will be on the husband. Still, we find that there's a forgotten lot in palliative care. These are the children. Yeah. So still we find that the responsibility now lies on the children. And that's the reason why even we see the children escorting their parents for treatment, for the clinics. So when you're talking about mental health, when you're talking about palliative care, they're just one thing. Yeah. Because sometimes if you don't deal with whatever the psychological pain that the patient has, it will be manifested in the physical part of it. Because this patient will be complaining of pain, but if I don't sit down with the patient to know what is wrong, I may be thinking, Jen, it is physical, but it's more than physical. Yeah, because sometimes I find patients, the marriage broke because of the disease. Yeah, the children, they don't go to school, because when I'm talking about palliative, I don't want to base just on patient alone, because from the definition it's about the patient and the family. So even the children, they're affected. Back in school, we have these children in school. If you find sometimes the teacher will say that maybe this child is unruly, maybe this child is not attending classes. You as a teacher, okay, can you find time to talk to these students? Because there's a lot maybe is going back at home, but since nobody is approaching the student to know more about it, they'll just suffer silently. Yeah, we'll see the performance even of these kids going down. Yeah, so palliative care is wide, palliative care is broad, and at the same time, it is very sad because whatever goes on in our communities, because there's lack of knowledge, and that's why many patients, there's that creation of stigma to our patients. Psychologically, they're affected, and that's the reason why by the time a patient comes to the facility, maybe the patient will come when the disease already is in an advanced stage. Yes.
Okay. So thank you so much for that, Emily. And as we continue, also at some point I had you mention of death, and that is the misconception we have had over the streets, where people tend to identify lifelong illnesses with death. Probably you can try to expound more on that, or rather shed light on the same.
Okay, thank you, Jen. Okay, for my viewers, maybe there is somebody out there who has heard about palliative care. There is somebody out there who has received palliative care, or still there is somebody out there who offers palliative care. One thing I've come across during my practice, or even currently, we find that even the people you work with, they'll call you when the patient is dying. But I appreciate, because we have found we have been offering health education, we have been doing continuous medical education, even to our colleagues, and we have seen some changes. Because many a times people think, okay, there's a notion that when you're talking about palliative care, you're only talking about death. And that's the reason why, even when I did my course, when I did my practice, when you go to a ward, when you go to visit a patient, there's a term you will hear people say, ni wale watu wanakuja kuona watu ni wanaenda kufa. Yeah. So it is very sad, but we are trying, and I know there's a lot of campaign outside there also that they're talking about palliative care, because from the definition, it's not about dying. And what people should know is that when one has been diagnosed with palliative care, it does not mean that this person will be in that, like a term palliative care patient. Yeah, because let me talk about a cancer patient who comes, Jen. Maybe you've seen cancer patient in the line of your duty. When a cancer patient comes, now it depends at what stage of the disease. So there are patient viewers who come or who goes to the facility at an early stage. Then the diagnosis is made early. This patient receives treatment. And then after treatment, after assessing the patient, the oncologist will consider this patient cancer-free. Yes. So this patient will no longer remain in that bracket of a palliative care patient. Yeah. But still, there are patients who are diagnosed as a palliative care patient, and they'll continue being a palliative care patient. So palliative does not start when the patient is dying. Palliative does not start, viewer, when the patient is going to an ICU. That's the time that you are being called that the patient condition has deteriorated. No. The first time that I meet this patient, the patient comes walking, the patient has come alone, the patient is healthy, but the difference is the diagnosis. That's where my palliative care will start, despite of the health status of the patient. So palliative is not about dying, and palliative is not for those people who have died. No. Yes.
Okay. Yeah. Okay, so thank you so much for demystifying that myth, that chronic illness, it's not a death sentence.
Yes.
Yeah.
Yes.
So also, Emily, from where you sit, I know that you have been privileged to engage with people who suffer chronic illnesses, and probably I will wish you to share with us what are some of the silent struggles that they go through, probably even away from their diagnosis. Yeah.
Okay, thank you, Jim. These things, it's very sad